In today's health headlines, we compare how the U.S. has fared against the virus versus other countries. A COVID outbreak in North Korea raises concerns for the U.S., and we're reporting around 90,000 new COVID cases nationwide every day. This is likely an undercount due to home testing, but just how much of a discrepancy is there? Joining us today is Dr. F. Perry Wilson, a Yale Medicine physician and associate professor at Yale School of Medicine. Doctor, welcome back.
Good to see you.
Good to see you. So with 1 million deaths from COVID in the U.S. now official, what is your insight on how we've fared compared to other countries?
I mean, it's hard to argue that the U.S. has done well during the COVID pandemic. We have the most recorded deaths of any country in the world, although obviously some large countries like India and China might not be reporting deaths accurately. But even per capita, we're the 18th lowest in the world in terms, or the 18th worst in the world in terms of per capita deaths, and with every country in Western Europe essentially outperforming the U.S. And so it's been very, very hard on this country, I think in part because we just don't have that healthcare infrastructure to really support people through the pandemic. And of course, we have the political divisiveness around, things like vaccines that ended up hurting people.
All right. And as a new COVID outbreak arises in North Korea, do you think the U.S. will be affected?
Well, we always have to worry about COVID cases around the world. There are 26 million people in North Korea. Every one of those infections is the potential for a new variant that could cause worse disease. And so I think the situation in North Korea has to remind us that protecting ourselves from COVID means we really do have to reach out and try to reduce cases around the world.
All right, let's talk about this. 90,000 new COVID cases are reported every day in the U.S. Considering how many people are now testing at home, how drastic of an undercount do you think this number is?
Oh, I think it's a very drastic undercount. You may hear my hoarse voice. I was testing at home. I was negative. I have some other kind of cold, but I didn't report my test results to anyone. And so I imagine at this point, if you look at the wastewater levels, if you look at hospitalization levels, we're probably missing around fivefold of cases if all tests were being reported. And because some people don't even test, I think we might be missing as many as tenfold of the cases. So if you suggested that there are 1 million cases, new cases of COVID infection a day in the U.S. right now, I would not be terribly surprised.
All right, and doctor, quick last question. What about mixing and matching COVID boosters on the fourth dose for those 50 and over who are eligible for that second booster, the fourth shot?
Sure. There's a little bit of evidence that switching from one mRNA vaccine to the other, Pfizer to Moderna or vice versa, might boost antibody levels just a smidge, but it really doesn't matter when it comes to overall protection. I would just be delighted if people actually got those boosters, especially as I suspect right now, we're in a bit of a wave that might not be being recognized because of the undercount of cases.
A lot of booster supply and appointments available. I've been reporting that, we know. All right, Yale Medicine, Dr. F. Perry Wilson, thank you very much for the very latest, as always, on a Monday afternoon.
Thank you.